I know from talking to disabled people in my constituency and across the country the dignity and self-respect that work can bring. The choice, control and autonomy from having money in your pocket and making the contribution you want in life. Work is the reason for our political party, and supporting working people is why members on this side of the House get up in the morning. That belief is shared by the British public, including hundreds of thousands of people who currently feel shut out of the workplace and trapped on benefits when they could work if they had the right help and support. On this government's watch, a staggering 2.6 million people are now out of work as a result of long-term sickness, the highest number ever, and up almost 500,000 since the pandemic alone. This is a serious challenge for millions of our constituents and the economy, and one that deserves a serious response. But that is not what we have seen today. Now, Labour has been warning for years that benefit assessments are not fit for purpose. And crucially, that unless we have a proper plan to support sick and disabled people who can work, even more will end up trapped in a degrading benefits system, costing them and the taxpayer far more. Now, Labour has already set out plans to transform the back-to-work help that's available by personalising employment support and tackling the huge backlogs in our NHS and social care. Our Interwork Guarantee will let people try work without fear of losing their benefits. Our plan is backed by the Centre for Social Justice, the Social Security Advisory Committee and disabled people's organisations. Why not the Secretary of State? We will ensure employment support meets specific local needs through proper devolution to local areas. And we will make sure when disabled people get a job, they get the support they need to keep them there as soon as they need it, rather than having to wait for months on end. Now, we will study this consultation carefully, but so far I see nothing in this statement that matches Labour's vision or scale of ambition. It does not even deal with the glaring problems in the current system. 80% of PIP decisions are overturned at tribunal, of which only 2% is due to new evidence becoming available. How will these proposals make any difference to the total inadequacy of decision-making, which causes untold stress to disabled people and wastes millions of pounds of taxpayers' money? The backlog for access to work assessments has trebled to 25,000 since the pandemic. How will these proposals help bring that down? Where's the plan to help slash waiting lists for help with anxiety and depression, which we know is a major problem? Or get the carers families need to look after sick and disabled relatives so they themselves can work? Madam Deputy Speaker, this is not a serious plan. It is tinkering at the edges of a failing system.
Exactly.
But if you run your NHS into the ground for 13 years and let waiting lists for physical and mental health soar, if you fail to reform social care to help people caring for their loved ones, and if your sole aim is to try and score political points rather than reforming the system to get sick and disabled people who can work the help they really need, you end up with the mess we have today, a system that's failing sick or disabled people, that's failing taxpayers and failing our country as a whole. Britain deserves far better than this.
It's not.